Podcasting from St. Louis, Missouri, this is Functional Wellness with Dr. Allison, your information and inspiration hub for all things health, wellness, and functional medicine. Your host, Dr. Alison DiBarto Goggin, has been practicing functional medicine for over 11 years. She is passionate about finding root causes and solutions for gut health, hormone balance, anxiety, and autoimmune conditions. Welcome to the show.
Hello and welcome. Today we are talking about feeling powerless, how to overcome it, what to do, and keep moving forward in your healing journey. So, right now, I'd like you to stop, take a deep breath with me, because this can be a really scary, overwhelming topic. So, I just want to take this moment to acknowledge that you are here, you're somewhere in your healing journey. Maybe you feel really frustrated, maybe nothing has been working for you, you're not feeling better yet. And you might feel like you're a failure or that your doctors or your medication or your support team has failed you. I know that you probably feel anger, jealousy, fear, anxiety, and it's all wrapped up with this possibility of hope and prayer and still trying to figure out that maybe something might work for you. And then you feel this huge overwhelm. So, if you don't know my story, I'm Dr. Alison DiBarto Goggin. I'm a functional medicine physician and a doTERRA wellness advocate. I help women overcome chronic health issues so they can feel like themselves again. And for me, I've been struggling with ulcerative colitis, which is a gut autoimmune disease, for a very long time now. And in 2020, it took a turn and almost ended my life. So I've spent the past year and a half trying to recover and heal and figure out what my process is. And it has been overwhelming and scary. And I have felt utterly powerless because everything that I normally do for my clients who have these issues wasn't working for me. So today's message is really for those who have been looking for help, both medically and naturally, and for those who are feeling almost like desperate for answers on why are you feeling the way that you are. One of the things that frustrates me, I think, is I hear my patients say a lot that they went to their primary care physicians and they were told that something was wrong, but they didn't know what. I had my patients tell me that their doctors told them that they were lying, that they don't actually have pain, that they don't actually have all of these issues, or they were lying about what they eat and their weight. That they won't run blood work. They've been told to just take a Tylenol for their periods that are coming every 2 weeks. And other people tell me their doctors won't test for things like autoimmune conditions or thyroid or even hear them for a moment. So this is a huge barrier that we have to overcome. And I'm going to stop right here and say if you're working with a doctor or someone in the medical field that won't run a test, you actually do have a few options. So you can ask that they document their refusal in their notes. So that will usually change their minds if they have to write patient requested this test, I am refusing because XYZ. You can present all of your research to them and information. So when I went in a couple months ago to my primary care, I said, hey, I think I have Epstein-Barr, and here's why, and here's my symptoms, and here's my history with it. Now I feel really lucky that my doc said, yeah, of course, no problem. Let's run this panel. And here's the panel I'm going to run and why, and which one will be the most effective for you. Wonderful. Now, other people might not have that response from their physicians. And what you have to understand is that most traditional MDs or DOs are not allowed to do functional medicine testing or even regular testing because one, they have to go through the insurance companies and I think they are protective. They're trying to be protective of you so you don't get a $2,000 bill for a test that they knew would not be approved by insurance. You can ask your doc, like, are you worried that insurance won't approve this or there's no reason to run it so they won't approve it? So that might be something that's holding them back. When I saw my first nurse at my first GI's office, she appeared to be awesome, but she was definitely limited by the scope of the practice that she worked for, the hospital that decided what they were allowed to order. She told me that when I brought her my GI map results and my organic acid testing and all the other tests that I did, she was like, wow, where did you get these from? Who ordered these? I'm like, I did. And she's like, this is really great because I wish I could run these, but I'm not allowed to. So that is a major stopping point for a lot of doctors who wish they could have the knowledge, but actually aren't allowed to. So you might have to switch hospital systems. You can check where your doctor is. You can find who in your area is getting these tests run and by whom, and go see their office. You can find someone who's in private practice that also opens up a lot of doors for them, work with a functional medicine physician, or you can pay cash as well and avoid the insurance questioning. I pay cash for my blood work, and we have co-ops that get it for a lot cheaper. A lot of times labs will offer um, financial aid for some people. They also offer payment plans, even for things like MRIs or CT scans. If your insurance doesn't cover it or your deductible is really high, you can find private companies. There's actually quite a few in St. Louis, Missouri, where I am, where you can go online and get a cash price. So an MRI is actually about $300, which is insanely cheap when you think if you went through insurance, it'd probably be about $4,000. Sometimes between 2 and 4 are the numbers that I've been seeing. So there are cash options, which is usually the route that you have to go if you're not getting the help and the testing that you need. On the other side of this, needing help is not a failure on your part. It's not because you needed more discipline or self control. It's not about your worthiness or your ability to heal. I feel like the natural community wants you to believe that your health is 100% within your control. And if you get sick, it's all your fault because you should have known better, done better. In a lot of sectors in chiropractic, it's all about religion and prayer and being worthy and not getting sick. And I think that's just such a lie, honestly, because we really don't have any control. Like, control is such an illusion when it comes to our health and what we don't even know or understand that is happening in our environment and the things that we are exposed to. For instance, what's in our water system, in our air, in our soil, like what our couches are made of can cause cancer. We have no idea. And even when we eat food and we think it's 100% healthy or organic, it probably isn't. It doesn't even have the same nutrition in it because of our soil practices and monoculture practices. Our genetics are changing with what has been passed down to us. And I I love talking about genetics, but I also really don't, because a lot of docs who talk genetics will tell you to just turn off the bad genes by eating healthy or eating greens or taking the supplement. And if you have bad genes turned on, it's all your fault because of your lifestyle. But what they don't teach or they don't understand, there's something missing in there, that your genetics were actually decided one a really long time ago, but when your grandmother was pregnant with you, this goes way back. I'm sorry, when your grandmother was pregnant with your mom as a fetus inside of her mother developed all of her eggs. So as an egg, you were inside your baby mom who was inside her mom. So anything your grandmother was exposed to was directly impacted, obviously, her pregnancy with your mother and then the eggs that she was carrying at that time. So we're talking about feeling powerless, but when I think about this and what my genes were literally exposed to out of my control when my grandmother was pregnant with my mother, it takes away a lot of that guilt and the shame of illness because we can't control everything. We can't necessarily control our genes or how our body responds to the modern world around us. And feeling out of control can really make us feel powerless. I can't control my immune system the way I would like to, right? I can't control how it's attacking my body, really, unless I take my medications. And I can't control if the medicine works or not. And I can't force my body to heal. There's so much that I can't control or affect. But losing control gives us really two options, and we need to use both. So, first, we need to accept the loss of control, which is so much easier said than done, right? So, maybe you have a new diagnosis of something scary like cancer or Lyme or lupus, something that is beyond your scope of control and really beyond your ability to heal yourself through lifestyle, food, supplements, just changing something that you need for their health. So you have to trust your providers, your doctors, their recommendations, and honestly follow through. Let others take care of that control for you and do your best to relax and to knowing that they are doing their best with what they have. The second part, I think, is to not give up hope, right? To keep searching for answers, get those tests on. What else can you do to support your health? Yes, I'm taking my medications, but I'm also taking my supplements. So I'm still doing further testing and support all the time to figure out how to best support my body, which is how I found out I have reactivated Epstein Barr because I want to be as proactive as I possibly can be. And I think about all of the things that I am doing, and it's been very, very focused on healing my ulcerative colitis. And I felt like a total failure. And even last week, I was like, what's the point of eating healthy anymore? It didn't cure my gut, it's not doing anything. And I had this major upset attack, and I had to step back. And I was actually talking with my therapist about it. And she reminded me gently that taking care of my body isn't just for the colitis. And there's so many other systems that I don't even think about because they are healthy. And I still need to care for my body in those ways because I still have other systems that need love and support. I have my liver and my heart and my brain and my hormones and my thyroid and my kidneys. Oh my gosh, we get so focused in on the thing that's wrong and what's working and what's not working. And when things aren't working, it's like, what's the freaking point of doing anything? But in reality, we need to take care of our whole body and not give up. Okay. So feeling powerless sucks. I'm not going to sit here and sugarcoat it and say it's fine, it doesn't, or it'll get better. It's normal to feel scared. It's normal to feel completely down about your future and hopeless. And you can allow yourself to feel that way. I give you full permission to sit here in fear and sadness and the scariness of it all. And when you've talked through it, cried it out, whatever you need to do to process how you're feeling, really think about what your next steps are and what you can do to be proactive for your whole health, for your current issue, and to not give up hope. Okay, so you can still be scared but still be proactive. You can live in both of those worlds, hold two horrible things at the same time. Okay, so if you're looking for personalized support, I would love to be able to work with you. You can schedule a free consultation online where we talk for about 30 minutes and brainstorm on your issues, how to move forward, and what you need. And thank you for tuning in. So make sure you like and subscribe, and we'll see you next time.
Thank you for listening to Functional Wellness with Dr. Allison. If you would like personalized care and testing, you can schedule a free introductory consult with Dr. Allison online at Little Black Bag Medicine or message us on Facebook at Little Black Bag Medicine. Thanks for tuning in, and we'll see you next week.